Have a nice day everyone. So for today's video, I will going to discuss the characteristic of first aider, objectives of first aid, importance of the first aid, basic life-saving steps, purposes of first aid training, and general direction for first aid. There are 6 characteristics of first aider. Observant. The first aider should notice all signs and symptoms of the illness. Resourceful. The first aider should make the best use of things at hand. Gentle. The first aider should not cause pain to the victim or patient. Thankful. The first aider should not alarm the victim or patient. Sympathetic. The first aider should be comforting on the feeling and pain experienced by the victim or patient. Cheerful. The first aider should have a happy expression that inspired confidence. Importance of first aid. To save life, to prevent permanent disability, to reduce prolonged hospitalization. And also the importance of first aid. First aid training focuses on providing immediate care to sick or injured patients until full medical help is available. In the time it takes for more advanced care to arrive, first aid aims to prevent medical condition from deteriorating, help relieve pain, and provide reassurance. Basic life-saving steps. Check for blood circulation or pulse. Check for breathing. Check for bleeding. Check for shock. Objectives of first aid. To alleviate suffering, to prevent further injury, damage, or danger, to prolong life. And also, to, the aims of the first aid include preserving life, is preventing injury from getting worse, aiding recovery, relieving pain, and protecting the unconscious. The main objective is to save lives, and the first aid training is doing that is properly implemented. Purpose of first aid training: to prevent accident, to train people to do the right thing at the right time, to prevent added injury or danger, to provide proper transportation if necessary, to give first aid for large numbers of person caught in the natural disaster. And also the purpose of first aid training is first aid help to deal with injuries and accidents by helping to keep injured victims in less pain before professional medical help arrives, providing essential items to treat injuries with minimal effect before consultations with a medical experts. The general direction first aiding. Don't panic. Don't panic is the first aider must remain calm so that her or she has a clear mind and during the emergency situation. Ensure the safety of the area. In the emergency situation, the first aider must first make sure that the area is safe for him or her and the victim. He or she should transport the victim to a safer place or necessary. Check for vital functioning. The first aider should assist the monitor pulse and breathing of the victim. Check for injuries. The first aider must conduct careful physical examination of the victim to prevent further injury. In cases of multiple injuries, the first aider should know which problem to treat first. Give the needed first aid urgently. The first aider must be capable of applying necessary and appropriate steps to attain the objectives of first aiding. Keep the victim laying down. The victim should be examined in laying position in order to immobilize the body. Keep the victim warm. This would help the victim recover faster by increasing the circulation of the blood throughout the body. The victim may be provided with a jacket, a blanket, or a body heat transfer by embracing the victim. Do not give fluids to an unconscious or partly conscious person. This must be noted by every person, not only in the first aider and rescuers. The water may enter the wide pipe and block the airway passage. Do not attempt to arouse an unconscious person by shaking him because it might cause further injury. Following injury, do not lift and gasping person by the belt. This may aggravate injuries of the back of or internal organs. And that would be all. Thank you.